Hey, what's going on, guys? This is Dan from Fitness Pain Free. I'm a physical therapist. I'm helping coaches and clinicians troubleshoot pain and injury in the gym. Let's show your patients how to get out of pain and back to training in the gym where they belong, right? In today's series, we're going over modifications for the bench press when you have shoulder pain, okay? And I went through a lot of different variations you can try with your patients. Oftentimes, you can't tolerate any sort of pressing, so that's pretty tough. You have a really aggravated shoulder, it's tough because you can try all the modifications in the world and it just doesn't work, okay? So sometimes you need some really far regressed movements for folks that are really irritable, and that's what we're gonna go over today, okay? So the first movement I like to try in folks that have a lot of shoulder pain is gonna be some sort of crawl variation, okay? So when I do a press, I unlock my elbows and I start to come down, and for folks in shoulder pain, it's usually the press that hurts. However, if you lock out the weight, that tends not to hurt these folks, okay? So you can often get away with movements where you're stabilizing something in front of you, but as soon as you start to press, it starts to get aggravated, okay? So if that's the type of patient that you're working with, and oftentimes these movements work really well. So the first crawl variation we'll go over, and probably my favorite for folks that have pain, is gonna be a backwards crawl, right? So we start in a bear position here. I'm gonna push away from the floor, knees come up in the air. Oftentimes, we want to make sure this feels good. This is actually a pretty good exercise for folks if they have some shoulder pain and they're very irritable. But if we're tolerating this well, we want to make it a little more challenging. What we can do is start taking steps backwards. We start with small steps. We can work our way to larger steps over the course of time, okay? Now, if you think about a crawl variation, what we're doing is basically this, right? That's the whole thing we're doing over and over and over again, okay? And this is not the same as doing the whole press. We're actually getting the active motion at the shoulder blade that we want. Because when we press, we have to come all the way down, but at the very end, we have to protract and upwardly rotate a little bit with the shoulder blade, and we're actually training that quite a bit, right? The other piece is that when you lock your arms out and hold a plank, you do get a little bit of shoulder work, you get a little bit of pec work, but not much, right? But the idea is that eventually we want to get back to pressing, which is going to use a lot of pec and a lot of delt. So doing a crawl variation allows us to get a little bit of work to the pecs, to the delts, a lot of shoulder blade work, which you know is helpful for folks in shoulder pain, so you can actually work a little bit towards their training goals, right, and simultaneously rehabilitate their shoulder pain as well, okay? The next crawl variation I like, if the backwards crawl is not going well, is gonna be a side-to-side crawl, all right? So same setup, hands and knees just like this. I press away from the floor, this is protraction, my knees pick up, and I take small steps to the side, okay? Now I can just go back and forth, 5 to 10 steps per direction, per side. And the idea is similar, okay? I like pushing backwards because I think that's a little bit more work for the serratus anterior. Side to side is not quite as much, but you still work the musculature around the shoulder blade, which can be really nice for shoulder pain, okay? Now, if crawl variations are going poorly, you can try a shoulder tap, okay? So you start in a push-up position, feet a little bit wider to maintain your balance. You want to pretend like there's a glass of water in your lower back, and you don't want to spill it, okay? So you don't want to rock your hips a ton while you do this. And you pick up one hand and tap the shoulder, okay? Back and forth. And lastly, if the shoulder tap is just not being tolerated really well, you can just incline the height. So imagine me doing that same shoulder tap, but against the wall versus on a bench versus all the way on the floor. So if you do that movement against the wall, super duper easy. If you go down to a bench, it gets a little harder, and you get down to the floor, it also feels a little bit more challenging, all right? And the last thing you can try with the shoulder tap is just protraction. So I'm here, sink the shoulder blades, all right, together, right? So the chest sinks through the shoulder blades, and then you push away from the floor, okay? So at least we get a little bit of protraction work, okay? So guys, if you have a patient in a ton of shoulder pain and it hurts most with bench press, and you try all the modifications and nothing works, you can try some of these crawl variations or shoulder tap variations to push the needle forward, right? And as soon as someone tolerates a pressing exercise, we want to start pushing them that way, okay? So that's it for today's video, but it's not it for your learning. So if you're a coach or you're a clinician, you're trying to troubleshoot pain and injury in the gym, get people out of pain and back to training, click on this video right here. Continue the learning. Once again, my name is Dan Pope. I'm a physical therapist. I'm going to help you get your patients out of pain and back to training. I'll see you on the next video.